Hi, my name is Chloe Blunk, and this video is for the axial skeleton, and this is going to be for the APU class Bio 235, the online anatomy class. And I'm just going to go through the list of bones that I have written down here. I printed the paper with all my notes, and I'm going to use Mr. Billy Bones here, and also I took pictures from the textbook onto my iPad so I can zoom in and go over more of the smaller structures as well, and I'll let you know what page number that is coming out as well. So first I'm going to start with the cranial bones. So we have the frontal bone right here, and then right behind, back here at the top, is the parietal bone. Right below that, right here, is the occipital, and we have the temporal bones, which are going to be on both sides of the skull, right here and there. And then on the back, if you take your fingers and you kind of feel like this knob-like projection below that most bulging point of the skull, right? You kind of feel this little groove. It's called an external occipital protuberance, and it secures the ligamentum nocae, which is a sheet-like elastic ligament that connects the vertebrae to the skull, to the neck and the skull. So that's why you feel that like bump on your head. A lot of times, right below that is where the ligaments connect. And so on page 208 of the 10th edition of the anatomy textbook, I have a closer view of the temporal bone. And so I'm just going to go over the temporomandibular joint I could not find in the textbook, but when I looked it up, it connects the jawbone to the skull. So I'm just assuming that it was somewhere over in this area, because here's the zygomatic process, here's the cheekbone. So I'm going to guess it's somewhere over in here. Then we have the mastoid process, which, see if you look at that better. We have the mastoid process right here, which if you kind of feel below, it's like right here behind your ear. Then you have the styloid process, which is right below that. It's kind of like this little, looks like a little pinky sticking out. That's what I think of it as. Like if you're going like this, a little pinky. And that connects the point for the tongue and the neck muscles. And then we have the external acoustic meatus, which is the opening in the ear, which you can see right here is a little opening. And then the squamose part, which is the top of the temporal bone right here. And then the petrous part of the temporal bone. It houses the middle and the internal ear cavities, which contain sensory receptors for hearing and balance. So that's going to be over in this big area. Sorry if you can't see it. This big area. And then the internal acoustic meatus, it's not labeled on here, but it's the internal part of the ear, and it transmits the cranial nerves 7 and 8. And then on page 209 of our textbook, we're going to go over the sphenoid process, or the sphenoid bone, excuse me. And I highlighted the main important parts. So we have I'm trying to angle it to where you can see it. Everything's opposite. We have the lesser wing right here, that little bone that's sticking out. Then right across from it, and it's going to be the greater wing. We have the optic canal, that little opening right there, and the optic nerve passes through there. That was one of the questions that was labeled. And the sella turcica, which is going to be, what is it? Do I not have it? Okay, well the sella turcica is what the pituitary gland sits on. Oh, there it is, right here. I'm sorry. So right in here, the pituitary gland sits in there. And then on page 210 of the textbook is the ethmoid bone, which is it's really small. It's right in here of the skull, and we're just going to go over the crista. Oh, there we go. I'm just going to keep flipping. Let's see, flip back over, flip back over. Okay, I don't know why it's doing that. But at the very top is going to be the crista galli, and it secures the brain into the cranium cavity. And then the cribriform plate, which I'm trying to figure out the best way to describe it without it keep turning, is, let's see. I'm just going to go to page 210 in the book. Sorry about that. found it. So I want to be able to visualize it. It's kind of these two little parts, and it's filaments of the olfactory nerves for the smell and receptors. So it's actually going to be right in here. That's where you see it. So it's for the receptors in the nasal cavity and brain. And next we're going to go over sutures, which are what connects all the pieces of the skull together. So the coronal is going to be, I don't know if you can see it, there's this big little line right across the top of the skull. So the parietal bones meet with the frontal bones anteriorly, so it's going to be right here. And then we have sagittal. Let's see, so sagittal is going to go right down the middle of the skull. So that's where the parietal bones meet superiorly at the cranium midline. Then we have the lambdoid, which is going to be right here in this little arch area. This is the lambdoid. Then we have the squamous, which is kind of lateral and inferior to the lambdoid. It's going to be coming up at an angle right there, and that's going to be the squamous. And that's just where the parietal and temporal bones meet laterally at the skull. And then next I'm going to go over some of the facial bones. So this is going to be on page 211 of your textbook. And we're going to start with the maxilla and the alveolar process. So the maxilla is the front part right here of your face, and the alveolar process is where the teeth are embedded and where they grow from. We have the nasal bone, the zygomatic bones, and the two bones that form that arch is the zygomatic process and the inferior lateral margins of the orbit. So it's going to be in this area. The ethmoid bone and the vomer, which is below the ethmoid. It's going to be kind of like in this area back here. And the two bones that form the bony nasal septum is the vomer and inferior nasal concha. And the inferior nasal concha is, it forms part of the lateral walls of the navel cavity. And then we have the mandible. So that is our jawbone, right? And so we have the body of the jaw, which is going to be right here. We have the angle here, and then the ramus is this part right here, the jaw. So if I don't know, this is the ramus right here. And then the mandibular concyle. It'd be easier if I show it this way. It's going to be at the top right here. And then we have the mandibular notch, which it's better to see on over here. It's kind of like that little curvature that's in the jaw right here. You can't even see it. You can barely see it him right here. That's the notch. And then you have the coronoid process, which is going to be this tip right here. You can kind of probably better see it right here. And then the vertebral column. So here's his back. So we have 4 curves in the adult vertebral column. These are going to be the thoracic and sacral coccygeal curves. So we have the cervical, which are going to be the secondary. You have cervical into thoracic, which is primary. Then it goes back into lumbar, which is secondary, and then back into the sacral coccygeal, I cannot pronounce it, into the curves down here, right before the coccyx area. And the cervical spine has 7. There's 7 cervical vertebrae. C1, which is the atlas, it articulates with the occipital condyle of the skull. So that's the reason why you're able to nod your head yes and no. So that bone creates that function. And what is unique about the cervical vertebrae is that they contain a transverse foramen through which the vertebral arteries can pass through to service the brain. And then next, we have the thoracic vertebrae, which there's 12. I kind of made this little drawing, but it's also on page 220 of your textbook. And so if you look at it posteriorly, this is going to be the spinous process, which if you look right here, helps out. So you have the spinous process, and then we have the transverse processes, which is going to be right in here. Then you have the vertebral arch, which is right in this area. And then what else? body or central. Oh, and here's the body of the vertebral discs. I'm going to pause it so I can continue on the next section since it's been 10 minutes.